I am Dr. Arjun, Managing Director of Sri Meenakshi Eye Hospital, Nallakunta, Hyderabad. Today I am going to talk about eye condition which is called as keratoconus. So keratoconus is a problem in the cornea, the front part or the black part which is there in front of the eye. Keratoconus is a problem where the cornea, the black part of the eye, becomes thin and it comes forward or it is protruding forward. So this condition in the medical terminology it is called as keratoconus. So the incidence of keratoconus is close to 1 to 1.5% in the normal population, and it is commonly seen between the age group of 12 years to 25 years to 30 years. So it is seen in a younger population, and the risk factors for this problem is allergy. So any allergy to the eye or any allergy in the systemic form where the patients rub their eyes when they are exposed to dust or any pollution, the very act of rubbing the eye with fingers can cause this problem in the cornea. So whenever we see a keratoconus patient, we ask the history of allergy and whether the patient is used to rubbing the eyes with fingers over the period of few years, and also any patient there can be a genetic predisposition to keratoconus. Any family member having keratoconus, brothers, sisters, or family mother, father having keratoconus, the children can get this problem. So these are the risk factors for keratoconus. So what happens in this problem is because the cornea shape is changed, it is becoming thin and it is coming forward. Because the shape is changed, the image which falls on the retina will not be clear. So the patients come with the complaints of blurring of vision and they can't see clearly the distance objects and also the near objects. So the usual complaint is that the vision is not clear. So these patients also have a complaint that whenever they see things like they see a window or they see a pencil, they feel that the images are distorted. So distortion of images is also a complaint of keratoconus. So other complaints of keratoconus include redness of the eye or watering of the eye, but those are rare complaints. But the common complaint is blurring of vision or distortion of the images. So when a patient comes with these complaints, we do a visual eye checkup where we see the vision of the patient. The vision of the patient can be less than the normal population, and also when we do a refraction or a glass checkup, we find a high cylinder in the refraction. So whenever we have a high cylinder in the glass power, we have to suspect a keratoconus, and these patients we have to see them clinically on a slit lamp examination where we see that the cornea is thin in the center part and also it is protruded forward. So whenever there is a suspicion of keratoconus, then we have to do a test which is called topography, where we can quantify the keratoconus. We can see whether the keratoconus is mild, moderate or severe based on the topography. So topography is an important investigation where we have to diagnose and also monitor these patients of keratoconus on a serial basis. So once a topography is done and we clinically diagnose that this patient is having keratoconus, then comes the next level of management. So the management of these patients include, in the mild cases of keratoconus, we can give glasses to the patient so that the vision improves. In moderate cases of keratoconus, the glasses will not help. Then we have to go for a contact lens. So special contact lens in the form of rigid gas permeable contact lens, or commonly known as RGP lens or hard lenses, are suitable for patients with keratoconus. So other contact lens like rose scale lenses or scleral lenses or mini scleral lenses can also be tried in advanced cases of keratoconus. Whereas in severe case of keratoconus, where the glasses will not help or the contact lenses will not help, we have to go for a surgery which is called corneal transplantation, where we replace the patient's cornea with a donated cornea. So these surgeries are called penetrating keratoplasties or deep anterior lamellar keratoplasties. These surgeries are used or reserved for patients who have a severe form of keratoconus where the vision will not improve either with the glasses or with the contact lens. Other modalities of interventions include placement of intracorneal rings, which can improve the visual quality of the patient. So these are also done for patients with keratoconus. Another problem with keratoconus is that it is a progressive problem. So the problem is not static. It keeps on increasing every month by month, every 6 months or every 1 year. So it's a gradually progressing disease. So to prevent the progression, what we have to do is we have to see the patients regularly on every 6 months basis, and we have to do the refraction, we have to do the corneal topography again, and if we feel that the disease is progressing, then we do a laser procedure which is called collagen cross-linking or C3R. So this procedure is done so that the disease doesn't progress and it stays wherever it is. And after the collagen cross-linking, again we have to give the patients glasses or the contact lenses. So the idea of doing collagen cross-linking is to prevent any further progression. So this collagen cross-linking procedure is a OPD procedure where it is done on a OP basis where the patients need not be admitted, and it's a daycare procedure. It takes half an hour time, and the patients have to be careful to 2 to 3 days. And another important advice what we give to the patient is that a problem of keratoconus, because it is progressive problem, we advise the patient not to get exposed to dust, not to get exposed to outdoor pollution, and whenever they go out on the road, they have to wear spectacles or helmet so that the eye is not exposed to dust and outside pollution. And the most important advice we give to the patient is that they should not rub their eyes. So because this problem is because of the rubbing of the eyes, we tell the patient to stop rubbing the eyes, because if they keep on rubbing the eyes, this problem is going to increase and the vision also will deteriorate over the time. And serial regular checkups to an ophthalmologist is very important. Every 6 months or every 3 months they have to visit an ophthalmologist for the regular eye checkup, so that we can diagnose this problem, and if at all this problem is there, we can appropriately treat it so that it doesn't progress to a severe form. Thank you so much for your patient hearing.